Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter N. Today I'm going to talk about neuritis and neuropathy. They all belong to the diseases occurred in nervous system. I think I particularly mentioned about this is for the peripheral nervous system diseases. Neuritis, for example, occur in the either localized pain, particularly, for example, the eye pain could be caused by the neuritis of the optic nerve. Let me just, before I talk more about neuritis and neuropathy, I'm also, I think, referring to the peripheral neuropathy. Before I talk any of those, let me just bring up the emergency situation. Is any emergent situation associated with this neuropathy or neuritis? Usually, I think clinical-wise, it's really kind of chronic process. It's not acute unless it's viral-caused neuritis. But however, the viral-caused neuritis is usually localized pain. It's not really an emergency situation that I can think of. So that unless the neuritis, like I said, the neuropathy impact some of the nerves, really, for example, the neuropathy involved in the swallow or breathing, causing the gagging and choking. If that's the case, probably it's emergency. Other than that, it's a chronic process or neuritis like subtle symptoms. So having said that, regardless whether it's neuritis, neuropathy, central or peripheral, for a patient, for people, if you have something you think is quite urgent, follow your sense. And in medical standpoint, if for those have lost muscle strength or cannot move or lost the sensation or tingling, the sudden developed drooling, is particularly in older people, or whether it's neuritis or neuropathy, peripheral, central, like I said, see the physician as soon as possible, or if your physician is not available, emergency room, to exclude the serious causes of these conditions anyway. So let me talk about can you manage this neuritis at home? I think some of the neuritis is just a supportive management, which means resting, use some pain medication to feel better, to soothe the symptoms. However, still need to be managed under the supervision from your physician. First of all, has to be diagnosed, exclude serious problem cause the symptoms. After the exclusion, then confirm diagnosis and neuritis, then either supportive or medication like a steroid to treat it. That depends on your physician, depends on the disease. But regardless, it has to be managed by the physician. Professionals cannot be managed at home. So let me just talk about the neuritis first. Usually neuritis can occur in terms of age group, can occur to all the age groups, young or old. Usually actually the neuritis occur in young people after the viral infection, the upper respiratory tract infection, and later on develop this eye pain, or even without symptoms of the upper respiratory tract infection, for example, develop this eye pain. It's really painful. You cannot see any symptoms, just the pain, or sometimes probably associated with the eyelid feel sluggish, cannot open, or you lost some partial loss of the vision. If that's the case, that's regardless for as a patient. Even though you probably know this neuritis or not know, but see the physician, either your primary care or your ophthalmologist, to diagnose it, to exclude any serious problems. And also the consequences for this neuritis could be serious, could be developed, like I previously mentioned. Autoimmune disease, a lot of time is on top of the viral infection. the body generated the antibodies to against the virus at the same time against the self tissues. That could happen. But regardless, so see your physician to get treated or get otherwise either supportive or medical treated. In terms of neuropathy, I'm talking about the peripheral neuropathy. It's quite, I think I mentioned several times, is either the retinopathy, which is the associated with the spine, the hernia disc, or without herniation but just the inflammation chronically causes this narrowed passage to pinch or press the nerves, or the neuropathy associated with other systemic disease. For example, the diabetic peripheral neuropathy is quite common. I think it's one of the most common neuropathy in older adult patient, and particularly in older with long term of the diabetes. And also hypertension, for example, can also cause neuropathy because the ischemic and the poor perfusion of the tissue, so can those nerve cells or nerve ending around this peripheral tissue can undergo ischemic damage, cause this neuropathy. So the symptoms of this neuropathy is different from the neuritis. The neuritis usually has the pain, it's quite sharp pain usually, because it's an acute process. Usually it's an acute process, with or without fever and the sensational change or any other impaired neurological function. For this neuropathy, like I mentioned, it's either the radiculopathy or diabetic neuropathy or hypertensive caused neuropathy. Usually it's a chronic process, so the symptoms is progressively. At the beginning, you probably did not pay attention, just a little numbness on one area, for example, the lower extremity. But you think it's probably nothing. You did not pay attention to it, and then the progressively getting worse and worse, lost the sensation completely, and then because of by the way, the pain for our body, it's one of the defense mechanism actually, even though it doesn't belong to the immune system, but it's equipped with us. For example, if you touch the sharp object, you sense it because this pain alerts you, so you remove your arm. So this is protective. For those neuropathy, peripheral neuropathy associated with systemic disease, lost this protection function. So then the bacterial infection or the ulcer can really go deep until touch the lower tissue, the deeper tissue like the bone or the muscle. So that's really caused the problem. Because you did not feel the pain on the skin due to this lost sensation or abnormal sensation of the peripheral neuropathy. So I hope that explained to you why it's so serious. So why the diabetic patient or hypertension patient need to follow up with your neurologist or your physician or your primary care or neurologist teaming together to manage this, to monitor your peripheral neuropathy. In addition to the tingling or numbness or the abnormal sensations, like I said, lost the pain sensation, which is really lost the defensive mechanism of one of it is quite important. Actually, there's some newborn people just without this pain nerve endings couldn't feel it, so that's quite dangerous. But anyway, this neuritis and neuropathy, I think the take-home message is, regardless of the cause, whether you know it is neuritis or neuropathy, see your physician to seek the medical advice and to get it diagnosed and treated accordingly. So I hope this video helps for those particular with chronic diseases. I'm going to stop here, and thank you for watching. I will see you next time.